Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and thanks for joining me back in the Sunflower House. On today's podcast, we're going to talk everything about kidney stones. And this is an important topic for a lot of different reasons. I'm a so called bonehead, meaning I'm an osteoporosis expert, so I'm interested in all things calcium metabolism. And the other reason why kidney stones are important is because they happen to over 500,000 people a year that have to go to the emergency room because they're in such pain. And many people have them and don't necessarily go to the emergency room or know what they had, or just have kidney stones and they haven't yet caused symptoms. So it's a relatively common problem, and it can be so painful, and it can require both medical and surgical urologic treatment. So, some of this information I'm taking from our speakingofwomenshealth.com website, and some of it comes from our Cleveland Clinic patient education information on the clevelandclinic.org website. And a lot of it comes from my medical training as well as my particular experience in the field of osteoporosis and some of the really frequent discussions that I have with patients all around calcium, bone, and kidney stones. Also, I have some personal experience in that my middle son, Emerson, when he was a freshman in college playing football, called me with intense, terrible right lower quadrant pain. And it was, he said, the worst pain of his life. And he was doubled over. And based on how he described it, it sounded like it was appendicitis. So I called my older son, Stetson, who's now the PhD in molecular medicine and cancer genetics. And he was a year older. He was a sophomore. And I said, Stetson, you have to stop what you're doing and take your brother right to the healthcare center or the emergency room. He's in excruciating pain. And Stetson, being so studious, well, I have class and I have a Senate committee meeting, because he was an elected representative at his college. And I didn't know what I could do. I was like flummoxed. I was several hours away. I had a full day of patients, and I couldn't get there right away, even if I could leave the office. And I didn't really have anything over Stetson except for I had the title to his car because he was on a full tuition scholarship. So I said, I'll take your car away if you don't stop what you're doing. So he took him to the health center, and they didn't really do very much. And the pain kept getting worse. So I said, okay, you have to take him to the local community hospital. So a little while later, I get a call from the emergency room physician, and he said, well, we've called in the surgeon. We don't have a general surgeon. We have a vascular surgeon because we're a small community hospital, and we're getting ready to do an appendectomy. And I said, oh, okay, well, what are the results of his test? And I said, what's the result of his urinalysis? That's when you dip the urine for blood. And the physician said, oh, we didn't get that. I'm like, excuse me, you didn't get that? No, you have to dip a urine. I mean, it could also be a kidney stone. So I prevented him from being wheeled off to the operating room to have a normal appendix taken out because they dipped his urine, and sure enough, it was positive for lots of blood. So he got pain medicine and fluids, and he didn't need surgery. And after I was done seeing my patients, I drove all the way down there, and I was wearing, I just had to throw clothes together really fast in a bag. I was wearing a Wabash Football College shirt because my youngest son was thinking about potentially going to that all-male school, which he actually eventually did. And when I got there to Emerson's hospital room, there was his head football coach at his bedside, which was nice. And my brother, his uncle Bob, who lived at that time pretty close to that small hospital, and I was the last one to the party, and the coach was horrified that I was wearing a Wabash football shirt instead of a Dennison. But the good news is Emerson totally recovered, didn't have to have surgery, had his pain relieved, and was out of the hospital the next day and back at school and on the football field. So I, of course, wanted him evaluated so that he wouldn't have to go through this again. And we'll get into that part of the story a little later. So we do have a free kidney stone treatment guidebook that you can get on speakingofwomenshealth.com. And if you've had a kidney stone or a loved one's had a kidney stone, or even if you haven't and you're just interested in calcium and medical information about being strong, being healthy, and being in charge. And I certainly obviously had benefit being a physician and a concerned mother. But I think that story is illustrative. Even if you have good health care, your healthcare team, the doctors, the nurses, the assistants, the clerks, the administrators, everybody's very busy working hard. And when something kind of seems obvious and they're kind of in that routine, and they see someone in pain and they want to get the right treatment, I did stop a surgery that didn't need to be done. And so learning about health information, even if you're not medical, and learning how to be pleasantly assertive but firm can help you advocate for your own health care. So, what are kidney stones? Well, let's first go to kidneys. You have two little kidney bean shaped organs on your back towards the retroperitoneal area. Their job is to clean, filter blood, and make urine, where some of the waste products go. Your liver is also a powerhouse too, and we'll have future podcasts on your important liver. Your kidney does not regenerate tissue, the liver does. So the kidneys work 24/7, and stones can form when the urine is either too concentrated with certain minerals or other substances, which normally are just pass in the urine without crystallization. But if there's not enough urine volume because you're dehydrated, and I do believe Emerson was quite dehydrated, getting up really early to work out and then going to class and then straight to football practice afterwards. Kidney stones can range in size from as small as a grain of sand or gravel or to the size of a chickpea. And I've seen some as large as golf balls. Smaller size stones, usually less than the size of a little chickpea, usually can pass through the urinary tract and the ureter on their own. But that's still pretty big for the ureter and the urethra, and it can be excruciating pain. Larger stones can actually get trapped in the ureters. The ureters are the tube that drain the urine from the kidney all the way down into the bladder, which is the storage organ for urine, until it's full enough for you to then visit the restroom and urinate. So anytime you block the flow of urine, it can be like imagined as a dam that's blocking a river, causing a severe backup, pain, and potential bleeding. And the stones that can't be passed on their own usually need to be treated with some sort of surgical or urologic intervention. And the decision about whether one undergoes surgery is based on a lot of different factors: the stone size, the number, the location, the shape, and of course, patient preference, getting complete informed consent of all the options. But if you have an untreated kidney stone that's blocking parts of the kidney's function and ability to clean and filter the blood can be impaired. And long term, kidney stones can actually damage the kidney. And as I mentioned, the kidneys don't regenerate. If you scratch yourself or cut yourself, your skin regrows. If you get a hepatitis infection that's not completely fulminant or fatal, the liver can regenerate. But the kidneys don't regenerate. We only have a certain amount. And with age, you peak at around age 30 or so, and then with age, it decreases. And certainly lots of medications and medical conditions like high blood pressure, diabetes, certain medications, especially arthritis type, aspirin, Motrin, Aleve, NSAID type pain medications, some antibiotics like gentamicin can be damaging to the kidneys. So it behooves all of us at any age to protect our kidneys, to avoid dehydration, to keep a normal blood pressure, not too high and conversely not too low, and to avoid toxins or unneeded medications that can harm the kidney. And that also goes for kidney stones, which can be silent if they're not blocking part of the genitourinary system. So some of the conditions that contribute to the formation of kidney stones can be a chemical abnormality in the blood or urine. And usually urine has substances that help prevent crystals from forming. but more than 90% of people with kidney stones have a chemical abnormality that contributes to this tendency to make stones. There's also medical conditions too that can predispose. There's medications, even foods, uh, maybe prions as well, and certainly dehydration. And some people chronically are dehydrated. They just don't seem to drink enough water. And if you don't ingest enough water or you're sweating a lot in hot environments or excessively exercising, you'll notice how your urine gets darker, dark yellow. It's concentrated. So the smaller the daily volume of urine, the more likely that a kidney stone will develop. And sometimes people will wake up or have kidney stones in the middle of the night because you're not drinking when you're sleeping. And some people stop their fluid intake after, 6 or 7 p.m. at night just because they don't want to have to get up and urinate during the night. And so anyone who's ever had a kidney stone, I always usually recommend to drink fluid regularly, including to get up once at night to urinate so you don't get dehydrated at night, to always have water bottles and drinks available in your vehicle, at your work, etc., to prevent that dehydration. And particularly people who live in really hot, dry climates, dehydration is a constant concern. And if you're on the job, maybe you're a surgeon doing a 6 or 8 hour procedure, or you're on a construction site, or you're in some sort of setting where you don't have access to food or fluid, that's another concern. Certainly extremes of age, it's easier for young children and certainly older persons to get dehydrated. And sometimes the sense of thirst is not as acute as people get older. You should know your family history for any medical problem, including kidney stones. So a family member with kidney stones means you might be more susceptible to developing a kidney stone. And most importantly, a previous kidney stone. And when I get medical histories and want to know, hospitalizations, major medical problems, a lot of patients will say, I had a kidney stone. Oh, but it was only once. Well, half of people who've had a kidney stone will get another one within 10 years. And I'm thinking, Emerson, he's come up on that 10-year mark, and knock on wood, he hasn't had another one. But he's had a mother who's talked to him quite a bit about preventing them because they're so painful. And 90% of people have a recurrent kidney stone within 20 years. Now, a diet that's very high in salt, sodium, super high in protein, and of course he was ingesting a lot of protein, bulking up, building muscle, being a collegiate athlete football player. Foods that increase certain acid levels may contribute to stone formation. Obesity and weight gain, which is a metabolic problem on several different levels, can be a risk. And there's many medical conditions. There's one that I deal with like almost on a daily basis that can cause higher or lower levels of substances that make up a kidney stone. And some of these conditions include the term, it's hypercalciuria. Hyper meaning high, calci meaning calcium, urea meaning urine. So it's too much calcium in the urine. And I talk about how we figure out calcium balance in a woman because 1 in 2 women by age 55 have osteoporosis. And calcium is the major building block of your bones. But if you just draw your blood work for a calcium level, it's generally always going to be normal unless there's some really serious problem. But it doesn't mean your calcium balance is normal because 99% of all the calcium is stored in your skeleton. And your body will steal it out of your skeleton to maintain normal blood levels of calcium, which are needed for muscle function, electrical conduction of your heart, and several cellular processes. So just because you have a normal calcium level in your bloodstream does not mean you have normal calcium balance. And the only way to figure out your calcium balance, because you have to first ingest enough calcium, your intestines need to absorb it. Once it's in your bloodstream, your blood is cleaned and filtered by the kidneys. And the kidneys filter out the calcium, and most of the time in most people reabsorb the right amount of calcium. But in some people, they have a distal tubular leak of calcium, and they can't resorb enough calcium, and they pee out too much calcium. And over time, especially with dehydration or other conditions, they can get a calcium stone. Most kidney stones are calcium oxalate. So after my son Emerson recovered from his kidney stone, usually you want to wait about a month or so, and you have to be on a regular diet, not sick, and no other restrictions on diet or activity. And you collect the urine for 24 hours. So he did that. And he never was a super high calcium milk drinker. He had a little bit of borderline lactose intolerance, liked yogurt, liked cheese. If you haven't listened to my calcium podcast that I did in season 1 around the time of, I think it was Memorial Day, that's a good one to listen to. And we have lots of information about calcium calculators on our speakingofwomenshealth.com site, how much calcium you need based on your age and your hormonal status. Pregnant women, nursing women obviously need more calcium. Postmenopausal women not on estrogen, since estrogen helps absorb calcium, also need more calcium. Most people need about 1,000 milligrams a day in divided doses, which is about 3 servings of calcium-rich foods. So he was never a high dairy ingester. Adequate, certainly enough. Took his vitamin D level, vitamin D, because of course I had checked his level, had his level checked, and he had been low, like lots of people in Northeast Ohio or northern climates who use sunscreen. And so all of that was normal. His diet was normal. His protein intake was appropriate for his age and his sex. And his vitamin D level was normal, which helps absorb calcium. And he had a very high level of urine calcium. And I remember talking to the physician, and the physician said, oh, he's young. He just needs to reduce his salt. And I'm like, well, he's not too high a salt user. Okay, we'll repeat the test and make sure he's not having any processed foods or using any extra salt. Sure enough, it was high again. And they're like, oh, he's young. I don't think really anything needs to be done. Well, here I came in advocating again. I'm like, no, I would like him started on a very low dose of a thiazide diuretic, which I prescribe regularly to many of my patients who have this hypercalciuria and have thin bones. Because if you spend a lifetime peeing out too much calcium, you steal it from your bones, and you can get broken bones, osteoporosis, loss of height, pain, needing orthopedic surgery, and you can have kidney stones, which are painful and can also damage your kidneys. So to take a very low dose thiazide diuretic to stop this process, and it's not a blood pressure dose, and I have a lot of patients whose other physicians may stop it saying you don't have high blood pressure, but the very lowest dose does not affect the blood pressure. And a lot of people with age have higher blood pressure over time, and if it slightly keeps it a little bit more normal for a longer period of time, that's probably obviously an advantage. So he was put on a very low dose, had the repeat 24-hour urine calcium, boom, it was normal. And he stayed on that ever since, and thankfully has not had another kidney stone. I mean, if they occur when you're on a plane or on a football field or in the middle of operating on a patient, or on a family vacation or a weekend or a holiday, not only do you have the pain, but you have the double whammy of being faced with an emergency that you possibly could have prevented. So anyone who's had a kidney stone really should have a full renal stone panel done after they've recovered. Certainly to at least look for calcium. And I look for a 24-hour urine calcium in a lot of my patients who don't have kidney stones, who just have a concern about a calcium metabolism disorder or osteoporosis or osteopenia. And we have lots of podcasts on osteoporosis from my book chapter on osteoporosis in the Cleveland Clinic Guide to Menopause I started with last season, as well as other podcasts interviewing experts in the field of osteoporosis. And we were really happy in our first season in 2023 to receive an award for one of the best podcasts tackling the field of osteoporosis. So hypercalciuria is one that's common. I pick it up probably at least in 30% of the patients who I evaluate them for it because of my suspicion. And it's good to do a 24-hour urine calcium because even if it's not abnormal and elevated that then needs to be treated and rechecked, many times it can show that the urine calcium is too low and that you're simply not ingesting enough calcium in your diet, and those people are the ones that might need a calcium supplement. Or it conversely could mean that there's something wrong with your gut and you're just not absorbing the calcium and it's just going all the way, through into the the feces and not being absorbed and processed in your body. So there are other medical conditions, hypertension. Most people over 50, by the way, get hypertension. And everyone, I think, by age 50 should have a blood pressure cuff, and certainly at least once a year you should have your blood pressure done. A lot of people can go and have the automatic cuff done at their local grocery store. A lot of safety centers and fire stations or community centers sometimes have a sphygmomanometer where you can get your blood pressure checked. It's good for every person, every adult, to have their blood pressure and done a little more frequently if it's up or borderline. And it only takes 2 readings of 130/80 to be diagnosed with hypertension. And the lower your blood pressure, generally the better it is on your brain, reducing stroke risk, on your heart, reducing heart attack and heart failure, and your kidneys. Diabetes definitely is an increased risk for kidney stones as well as renal disease. We mentioned high body weight, obesity. We've had several podcasts in our first season on some of the exciting new therapies for metabolic syndrome and obesity. Gout. Certainly some people genetically get more uric acid, which can be put and crystallized in joints, which causes very painful gout. It also, these crystals of uric acid can crystallize in your kidneys. Kidney cyst, a condition, cystic fibrosis, which is a autosomal recessive disorder. That certainly can affect the lungs and other parts of the body. Parathyroid disease. There are 4 glands here in the neck inside of the thyroid that make parathyroid hormone, which help regulate calcium metabolism. And in many postmenopausal women who are low in estrogen, they may develop an adenoma, or they make too much parathyroid hormone, and that mobilizes calcium from the bone, which can raise the calcium levels in the bloodstream, which if they get too high can cause confusion or personality changes, constipation, and then extra calcium can be secreted in the urine because it's being mobilized from the bone, and that can lead to kidney stones. Inflammatory bowel disease like Crohn's, ulcerative colitis, especially things that affect the small intestine, can predispose to more oxalate type of kidney stones. Any chronic bowel disease with chronic diarrhea. And then there are some surgical procedures that do increase the risk of kidney stones, such as bariatric weight loss surgery or other stomach or intestinal surgeries for inflammatory bowel disease, or any gastric bypass surgery, anything that kind of disturbs the normal homeostasis of the gut neurotransmitters and hormones and microbiome. Now, there are a number of medications that can also increase your risk of developing a kidney stone. People who take excessive calcium-based antacids, which really aren't antacids, by the way, or people who are taking very high doses of calcium supplements when they don't need it. There is a medicine that's used to treat HIV infection, Crixivan, which is also associated with kidney stones. Probably some of the more common types of medication I see associated with kidney stones, Topamax or topiramate. It's an anticonvulsant, but it's used a lot to prevent migraine headaches. It's also a mild appetite suppressant, and it's combined with other medicines used to help suppress appetite and treat obesity. Dilantin or phenytoin, which is an anticonvulsant used to treat seizures. And many of the anticonvulsant medicines can have effects on vitamin D metabolism and bone metabolism. So just like if you've been on long-term prednisone or glucocorticoids, you need a bone density, the same is true of other medications that are bad on the bones, like some anticonvulsants. An antibiotic, ciprofloxacin, which has also been associated rarely with tendinitis and tendon rupture. Some antibiotics like ceftriaxone. And I also caution against excessive vitamin C supplementation, especially over a gram. And triampturine, which is a diuretic that helps raise potassium, which is helpful if you're on hydrochlorothiazide or hygrotin or other diuretics, rarely can be associated. Now, certain foods might increase your risk of kidney stone. So if you eat a lot of foods that are extremely high in animal proteins, like you're on a carnivore type diet with lots of meat and poultry, especially if you add a lot of sodium to it, diets that are high in salt from processed foods, and there can be so much sodium hidden. In fact, if you buy pre-made uh, foods in the kind of major section of the grocery stores, you really need to read labels and look at the sodium content. And in general, you want to avoid excessive processed foods. Other things that you want to avoid, sugars like high fructose corn syrup and sucrose and just all this gratuitous sugar. So, you have been listening to the Speaking of Women's Health podcast, and I am your host, Dr. Holly Thacker, in the Sunflower House. And we have been talking all things kidney stones, calcium, prevention, advocacy. In terms of how do you know you have a kidney stone? Well, it's usually not silent. When it starts to move or becomes large or starts causing tearing of your urogenital epithelium, you can have severe pain. It could start first as a dull ache that might be a little colicky, but it can be quite severe, requiring you to go to the emergency room. If the pain is very severe, you can have nausea and vomiting. Usually there's blood, at least microscopic blood in the urine, so always ask for your urine to be dipped. You may feel pain when urinating. You might be unable to void, or you might have more frequency. If you're experiencing fever or chills, you could be getting some urosepsis or infection from it. But then again, some kidney stones are silent and don't cause symptoms. So if your physician or advanced practice practitioner is concerned, they usually start with a physical exam, a review of your medical history and medications, may get an imaging test like a KUB to look at the kidneys and see if there's any calcification. CAT scans, ultrasounds can also be used. Blood tests to see what your kidney function is, to look for signs of an infection or metabolic abnormalities, urine dip, and maybe a culture to look for signs of infection. And as I mentioned later, a renal stone panel, a 24-hour urine calcium test to examine other stone-forming substances besides calcium, like oxalate, urate, cysteine, xanthine, and phosphate. Now, a CAT scan of the abdomen is an imaging test that's a three-dimensional view that gives really great views of all the organs in your abdominal cavity. And typically no contrast or dye is used to see the kidney stone for diagnosis. And it usually shows the size of the stone and any conditions that might have caused it to form. An ultrasound of the urinary tract uses sound wave tests to detect stones or any indirect evidence of stones, such as hydronephrosis or swelling of the kidney from obstruction. So say you've had a kidney stone or you've been diagnosed or your loved one has, you're going to want to say, how can we treat this? How can we prevent it? And it all depends on where it's located. Usually you need to see a urologist if there needs to be any type of intervention. But some don't need any intervention. Small stones may pass on their own. You may be given pain medicines, told to push fluids, and sent home with something to strain your urine, because if you catch that stone, we don't want you to just flush it down the toilet. We want to look at it under the microscope and be able to figure out what that stone is made of. Most kidney stones are calcium oxalate. And hence, if you're peeing out too much calcium, we can treat that and prevent that. And if you have too much oxalate, there's manipulations we can do to reduce that. Sometimes medications are used to relax the ureter to hopefully let that blocked stone pass. There are, thankfully, minimally invasive procedures that can be carried out through entering a very small incision through the body's natural opening, the urethra, going into the bladder and then up to the ureter. Sometimes drinking plenty of fluids might help flush that kidney stone out, and it may take up to 4 weeks. So in terms of medications, certainly severe pain usually needs to be managed by IV or intramuscular opiates, maybe anti-inflammatory drugs, anti-nausea medicines. Some minor aches and pains might be able to be managed with ibuprofen, but it can increase the risk of kidney failure if you have an acute attack of kidney stones, if you already have impaired kidney function, if you already have diabetes or hypertension and obesity. Sometimes medicines are given to relax the ureter, such as Flomax, the generic is tamsulosin, nifedipine, which is a blood pressure medicine, also known as Procardia. Sometimes that might help. Some of the minimally invasive procedures that our urologists do include looking with a little scope in the ureter, doing shockwave lithotripsy, or percutaneous going through the skin into the kidney to do a lithotomy. It all depends on medical conditions, the stone, the patient's medical conditions, and preferences. So when you go in to look through a scope through the ureter, a little camera is used. It's inserted into the urethra, which is painful, so you do need some local anesthesia. But the instruments are very small and allows stones to be seen and sometimes retrieved via a little basket. And the stone can be broken apart from laser. And if these are broken up in small pieces, it's usually more easily able to be removed. Many times a urethral stent is needed after the procedure to keep the tubes open, and usually 2 weeks later they're removed in the office. Now, shockwave lithotripsy is a high energy shock waves that are sent through water directly to the kidney stone location, and it breaks apart the kidney stone, which is then usually a lot more easily excreted. But sometimes someone needs to go to the next step, which is percutaneous nephrolithotomy, because they're too many or they're too big or they're too hard. And you do need a surgical incision. And stones are disintegrated by an ultrasound probe and then extracted via a special suction that reduces the chance that you'll pass fragments, causing the pain of kidney stones. And usually patients are kept overnight and discharged the next morning. The amount of time it takes to pass a stone varies. If it's less than 4 millimeters, it's usually within a week or so. If it's more than 4 millimeters, it could take 2 to 4 weeks. So, most importantly, how do we all prevent kidney stones? Drink more fluids, especially water, 64 ounces per day. Liquids help you stay hydrated. You'll urinate more often, which flushes things out. Limit the amount of salt or sodium. The DASH diet is a heart-healthy, low-sodium option. Work to lose weight because obesity causes so many problems. Manage your diabetes. Look at your diet. Do a food journal. See if there's anything that you're ingesting that may increase the risk. Go and do that 24-hour urine collection. I tell you, I think I have less than half of my patients. And someone who works with me, who will be on this podcast, who will remain unnamed for now, I just saw her in the office and I said, okay, I'm ordering this for the 3rd time. You have to do it. And people are busy and, you know, especially women, they have to work and take care of their families and everyone else. But you do have to take care of yourself. And at least at the Cleveland Clinic, when I order a 24-hour urine calcium, my order is only good for 49 or 59 days, less than 2 months. So if you bring your big jug of urine that you spent 24 hours collecting and it's too late, the lab will throw it away. So you have to bring your requisition slip and your big jug of urine. And most labs will give you not just the container, but if you're a woman, a little hat so that you can pee into that and then pour it into the jug. But that is a very, very important and simple test. And your physician, nurse practitioner, nutritionist, dietitian, all of that, those people in the team should be able to help you identify what things you may be able to change in your diet. Now, the most frequent question I get from anyone who's had the pain of a kidney stone is, should I cut out calcium from my diet if I have a calcium oxalate kidney stone? And the answer is no. We all need calcium. We all need about 1,000 milligrams. More calcium is not better. It's not like more money in the bank might be better for your bank balance. You just need an adequate amount. You don't need too little and you don't need too much. And calcium and vitamin D are necessary, but they're not sufficient to treat osteoporosis, which is a disease condition. You need those substrates, those building blocks, but more building blocks won't get the bone built without the other needed factors. So calcium is important, and restricting calcium is not going to be the treatment. However, you do want to probably try to lower your oxalate. And so, foods that are typically high in oxalate are spinach and teas, rhubarb and strawberry. You know, those rhubarb strawberry pies in the summer? Dried peas and beans and nut butters. You know, some people eat, like my brother can eat like a jar of peanut butter in a day. That's a lot of oxalates. Wheat bran. Now, foods that are high in calcium, which generally you need maybe 3 servings a day spaced out, could include a serving of milk, a serving of yogurt, a few ounces of cheese, a serving of broccoli, dried beans, salmon, sardines with bones. There's also lots of calcium fortified cereals and juices. And there's lots of non dairy milks for people who don't want dairy milk but might want almond milk or soy milk or coconut milk or flax milk. And those are rich in calcium. Another question I get is, should I drink diet soda and coffee if I have kidney stones? Well, there are some beverages that aren't particularly recommended, particularly soda if you have kidney stones, because the sweetened and the dark colas have been linked to an increased risk of stone formation. And we also tell people in general, but certainly with kidney stones, to avoid sugar drinks with high fructose corn syrup. Coffee, however, has been linked to a decreased risk of developing kidney stones. And studies show that people who drink coffee have fewer kidney stones. And Emerson did start drinking coffee after his kidney stone. And coffee has some antioxidants, may be good for brain, possibly might reduce some Alzheimer's and Parkinson's, fatty liver. We did a podcast on coffee, tea, or me, or fatty liver. We have that column also on speakingofwomenshealth.com. So in general, we all should be talking to our healthcare team about the best foods and drinks that are important for us based on our medical condition and our goals, as well as particularly if we have kidney stones. And you also need to know that what works for one person may not work for another. Sometimes the low-dose hydrochlorothiazide 12.5 is not quite enough to treat that hypercalciuria. I might need to go to a stronger hygrotin, which can lower potassium. Many times we'll use potassium citrate to boost citrate in the urine. And citrus foods, I usually tell people who've had kidney stones to add a little lemon or lime or orange slice to their water. And it's very interesting because one of the habits that only Emerson had out of my 3 sons was he likes to eat the rinds of citrus fruits. And I always thought that was strange. Well, there's so much citrate in that. I think it's a little bit bitter. But there's other ways to get citrate in your diet. And if you have had calcium oxalate stones and you are not getting enough calcium in your diet and you have to use a calcium supplement, the only supplement of calcium that someone with a history of calcium oxalate stone should take is calcium citrate, which is one of the brands is Citracal, but there's others. It's the citrate salt of the calcium. And that, incidentally, is absorbed with or without food, whereas calcium carbonate, like in Tums, needs stomach acid to be absorbed. And in general, most people don't need a calcium supplement, but if your 24-hour urine calcium level's low, under 100, then that means you're either not ingesting or absorbing enough calcium. And if you have had hypercalciuria and are doing things dietary-wise, like reducing salt, boosting your citrate, as well as possibly taking a thiazide diuretic to reduce that urine calcium loss, then you do need to go through the little bit of a hassle of repeating that 24-hour urine calcium to prove that it's working. So we are concluding this episode on all things kidney stones. Thanks so much for joining me. And don't miss a future episode. You can subscribe for free. Just hit follow or subscribe on Apple Podcasts, Spotify, TuneIn, wherever you listen. And if you've enjoyed this episode and you want to help support us, share it with others. You can donate on speakingofwomenshealth.com or just simply leave a 5-star evaluation and a little review. And I'll see you next time in the Sunflower House. Be strong, be healthy, and be in charge.